This video was produced as an educational project and is not intended to provide expert information. Always consult manufacturer's information and qualified professionals before attempting to service your biomedical equipment, and always follow safety warnings. In this video, we will first introduce the design and function of otoscopes and ophthalmoscopes. We will show how they are assembled and how they operate. Then, we will discuss two primary problems associated with otoscopes and ophthalmoscopes: a light that does not turn on, and an image that appears blurry to the user. Various possible solutions will be discussed for each problem. There are many similarities between both the design and function of otoscopes and ophthalmoscopes. For example, some handles are universal and can interface with both otoscopes and ophthalmoscopes. For these reasons, many of the discussed designs, functions, and troubleshooting techniques apply to both devices. When information applies to both otoscopes and ophthalmoscopes, the word scope will be used. Otoscopes are devices used to visually inspect the ears. They can be used to inspect both the ear canal and eardrum, and are sometimes used to inspect the nose and upper throat. An inspection of the ears is part of a regular checkup in order to identify diseases or physical barriers such as buildup of earwax. The clinician uses the otoscope to shine a bright beam of light into the ear, allowing them to view structures and barriers within the ear. Ophthalmoscopes are devices used to visually inspect the backs of the eyes. They can be used to determine the health of the retina, optic disc, and vitreous humor of the eyes. An inspection of the eyes is part of a regular checkup in order to identify retinal vascular diseases and eye diseases such as glaucoma. The clinician uses the ophthalmoscope to shine a bright beam of light into the pupil, allowing them to view the back of the patient's eyeball. Depending on the model, scopes can be powered by disposable batteries, rechargeable batteries, or a wall plug. The handle of non-corded scopes contains the battery, the light source, and the power switch. Mirrors direct the light from the bulb to the head of the scope. The head of the scope twists onto the handle. The light intensity of the scope is adjusted with a collar at the top of the handle. Both scope heads have a low magnifying lens, which aids the clinician in seeing small structures within the ears and small details within the eyes. Mounted on the otoscope head is an attachment for ear specula, the conical tips that probe the ear canal. Specula can either be disposable or reusable. If there's no light, it's possible that the battery is not charged. For scopes with reusable batteries, place the scope in the base, which serves to store the scope and recharge the battery. Check the color of the light on the base. If it's green, the battery is charged. If it's orange, let the battery charge until the light turns green. If there's no light, check that the charger is plugged into a working wall outlet. Note: some otoscopes and ophthalmoscopes come as a set with a double charging port. In some models, if one of the scopes is docked incorrectly, the other scope will not charge. Check that both scopes are docked correctly. If charging the battery doesn't work, it's possible that it can no longer hold a charge or is damaged. Remove the battery from the handle. This involves unscrewing the cap on the bottom of the handle and firmly tapping the shaft of the handle on the palm of your other hand until the battery shakes free. Check for signs of visible corrosion. Use a multimeter to test that the battery still carries a voltage difference. If the battery is damaged or can no longer hold a charge, a new battery may need to be purchased. With the bottom cap removed, check that the bottom cap spring is present. This spring holds the battery in place to enable electrical connections, so it's essential that it's present and interfacing with the battery. If it's not, a new bottom cap spring may need to be purchased. Screw the bottom cap spring back onto the bottom of the handle. If the battery is in good condition and appears to be capable of holding a charge, and the bottom cap spring is in place, it is possible that there is a problem with the light bulb. Remove the head of the scope from the handle. This involves rotating the head counterclockwise as viewed from above until the notch within the handle can spring free and the head can pop off. The light bulb sits at the base of the head. Use your fingers to grip the bulb and gently pull it straight out. Check for signs of visible damage to the bulb. Use a multimeter to verify that there is continuity between the brass ring of the bulb and the chrome plating on the outside of the bulb. If the bulb is damaged or if there is a break in the circuit, a new bulb may be needed. Many scopes come with bulb replacement, or bulbs can be ordered online. Ensure that the type of bulb matches the scope specifications, since scope bulbs can be halogen, xenon, or LED bulbs. LED bulbs typically last 7 years. Place a new bulb back into the base of the head and put the head of the scope back on the handle. Ophthalmoscopes have different settings for different patient pupil conditions and different light conditions. This is controlled by an aperture dial on the front of the head. The large aperture is used for pupils that have been dilated with drops. The medium aperture is used for non-dilated pupils in a dark room. The small aperture is used for constricted pupils in a well-lit room. Check that the aperture setting corresponds to the size of the patient's pupil and the light conditions of the room. Ophthalmoscopes have a diopter dial on the side to compensate for imperfect clinical vision. If the clinician has normal visual acuity, or if they wear corrective lenses, they can set the diopter dial to 0. If they do not have normal visual acuity and are not wearing corrective lenses, they can set the diopter dial to match their prescription. To troubleshoot, set the diopter dial to an appropriate setting. Look through the ophthalmoscope 1 arm's length from another person's eye. Make small adjustments to the distance to see if the image becomes clear. Now that visual acuity is being accounted for. Ophthalmoscopes have different filters for different uses. This is controlled by the filter switch on the front of the head above the aperture dial. The red free filter is used to look closely at vasculature. The blue filter is used to look for corneal abrasions or ulcers with fluorescein dye. The slit is used to look at contour abnormalities of the cornea, lens, or retina. The grid is used to approximate the relative distance between retinal lesions. Check that the filter setting corresponds to the intended use. For troubleshooting purposes, it may be best to remove all filters. Both scopes have a viewing window on the back of the head that can become dirty or foggy. The otoscope viewing window can be removed and cleaned with an alcohol wipe. The ophthalmoscope viewing window cannot be removed, but one side of it can be cleaned with an alcohol wipe. If this doesn't work, the viewing window might need to be replaced. If, after these 4 steps, the image is still blurry, then there might be an issue with the lenses or mirrors within the scopes. If this is the case, the entire scope must be replaced. Appropriately sized lenses and mirrors are not sold separately and cannot be replaced manually. For additional information, please consult the service manual of your device. To order replacement parts or a replacement device, please consult the website for your brand and model of device.